Some of our patients ask us some pretty technical questions. One is the strength of a Bioclear restoration.
So let's talk about the relative strength of a Bioclear restoration. The neat thing about these composites when they're monolithic and injection molded with the Bioclear method is that they have some resilience or it's a little bit bouncy on the surface, and patients like that feeling that the teeth are not as sort of hard or brittle as a porcelain material can be. So it's very comfortable when you bite together on the material. The compressive strength of composite is around 365 megapascals, which is pretty similar to one of the ceramics that's commonly used, which is dilithium silicate. So in terms of, is it strong? It really depends on the way it's placed around the tooth. So composite, if it's sort of patchwork, like if you're going to do a home patchwork job of asphalt in your driveway, it's not going to work very well. If you have real professionals that come in that have the right thickness of the asphalt, that heat it to the proper temperature, and have a uniform layer of asphalt, it can last for decades. So the composite materials, just like these Boeing airplanes, the composite materials, if injection molded with heat and pressure, without gaps and seams, without hand manipulation, it's incredibly strong. We just don't worry about fracturing of the tooth because of this beautiful inherent strength of the composite. But once again, it gets back to how do you put it around the tooth? That's when things fall apart. So the Bioclear method is simple and strong.